Okay, great. Yeah, those student testimonials are really pretty awesome, right? Not students, I guess, recent alumni are really fantastic, and I think demonstrate how we're making, increasing efforts to kind of integrate students' different pieces of student experiences related to Latin American and Caribbean studies together as they kind of move through WPI and also think about their careers after WPI. So, following them, we have another group of alumni who graduated from WPI a few years earlier than those that you have just seen. But what brings them to us is that they all work in industry and are all from Latin America and the Caribbean, right? So alumni that can, give us a really good sense of another way that WPI interacts with the region. In an everyday way and in a long-standing way as well. So our discussion today is going to be built around sort of the economic impacts of COVID-19 in the region, and thinking about obviously the very recent past, the present, and also the future in sort of the near to medium term, and how sort of the pandemic has affected, in particular, the economy in the region. In addition to some social issues as well that may be related, right, to economic and health issues. So we have, a set of panelists from a diverse set of countries who are engaged in a number of different industries within the region, who I think can demonstrate some commonalities and some differences and give us some critical insights on the crisis and how it is affecting economies, markets, communities, and those sorts of things. One of the interesting things that came out of the preparations that we made just sort of in meeting, sort of as a group a couple weeks ago, was that there's definitely some extreme difficulties, right, that are worth highlighting associated with the crisis, but it's not without its opportunities. And I think that's something that's been really interesting, in other areas, right, of science and technology, but also, sort of other ways that, sort of opportunities can stem from periods of crisis. And I hope that comes out today to some degree as well. So joining us today, as you see on the list here on the slide, is our Leila Carvajal Erker, who's the CEO of Koko Supply, which is based in Ecuador. It's a company that brings sustainable cocoa products and chocolate to international markets from Ecuador. Also joining us is Hernando Carvajal, who's a managing director at BMW Group in Latin America. He's based in Mexico, but he is originally from Colombia, and a graduate of WPI, obviously, as all of our panelists are. We also have Fernando Mota, who is the CEO and general manager of Felipe Mota, which is sort of a luxury goods wine distribution wholesaler and retailer in Panama. And finally, Carlos Zucolillo, who is an executive director of FAPSISA, which is in Paraguay and is a distributor of light machinery and industrial equipment. So I hope you can see how we have, as I was indicating, kind of a pretty diverse panel here in terms of the region and also the types of economies and markets and industries in which they're involved. So if you could just go to the next slide, please. So I just thought really, really briefly to start out with one slide on the impact that COVID has had in the region from a health perspective, just to provide a little bit of background. I don't think it's an exaggeration to think of the region as among the most hardest hit from a global perspective by COVID. Obviously maybe alongside North America and Europe. It's been, the effects have been extreme. Most of you probably have heard about the degree to which Brazil has been affected by COVID and has the third highest recorded cases in the world after the United States and India. Over 6 million as of today, and about 175,000 deaths as well in Brazil. But it goes much beyond that, right? Argentina, Colombia, Mexico, some of the larger countries, outside of Brazil in the region, all with over 1 million cases, Mexico with over 100,000 deaths. And those are the recorded cases, right? The reported cases. We have to remember that there could be non-reported cases that are not in sort of the official World Health Organization data. I think beyond those bigger numbers, the cases per capita in the region have also been really critical in a number of different places, in the Andes, in Central America, places where the populations are not quite as high, but the incidence rate per capita has been really significant. And obviously this has translated in very important ways to economic output, changes in economic output, negative growth, and a restructuring of economies, both on the macro level and the micro level, right? We have to think of these economies being affected from a national standpoint, but also, due to the integration of Latin American economies in global markets, as every other place is. They're entirely dependent on the ebbs and flows of global industry and global commodities prices and exports and imports and those kinds of things. So it's hard to isolate in some ways the two, domestic and international. But the bottom line is that the economic downturns in other parts of the world have certainly also affected Latin America and the Caribbean in significant ways. The latest data from the IMF, the October World Economic Outlook, was for a greater than 8% decline in GDP. That's for the region. Mexico, I think, was about 9%, Brazil about 6%. These are all negative growth numbers for 2020. Slight growth, maybe a bit of a recovery next year, but from a very, very much lower base, right? And I think that may be optimistic even, right? Given sort of the situation that's happening in a number of places and a number of the major economies and smaller economies in Latin America and the Caribbean. So just to give you kind of a brief outline of sort of where things sit health-wise and economy-wise from a very sort of top-down sort of perspective. So what I'd like to do is to just invite the panelists to join us. And if we could stop sharing the, okay, great. The slides, we can welcome again our panelists. Thank you very much for joining us. It's been a true pleasure just interacting with you and developing sort of the topics for discussion today. So I'm going to ask each of the panelists a question and to foster some discussion sort of along these lines in relation to sort of economics and social issues and maybe the path forward, right? As difficult as that may be to determine at this time. So I'll start with Fernando, and I'm wondering if maybe you could just, sort of start us off with a discussion about maybe some of the principal economic consequences. Just sort of, a good place for us to start is to think about what are the major economic issues that the crisis that have emerged sort of from the crisis, over the last 8-9 months.
Thank you, John, for the question. It's really an honor and a privilege to do this panel with my fellow alumni. To answer the question, I must first note that pre-COVID, Latin America as a region was already lagging behind in terms of social development, and it was going through its slowest periods of growth in decades. Right. Then COVID hit, and as John just mentioned, it has hit Latin America harder than any other part of the world. The region has 8% of the population and about a third of the COVID deaths in the world, and 8 of the top 15 countries in terms of death per capita for COVID are in Latin America. So the region is also experiencing one of the biggest contractions among developing economies, with most GDP estimates that I've seen for the region predicting, as John said, 8 to 9% contraction. So almost for sure, reduced revenues and increased debt will make it harder for governments to run social programs to protect the most vulnerable sectors, which of course have been the most affected from COVID. So to answer the question, for me, increased unemployment, increased poverty, increased inequality, and a real risk of social unrest will be the principal consequence of COVID in Latin America, unfortunately.
Right, yeah. Yeah, and your mention of debt, I think, is interesting, and I don't know if other folks want to, sort of comment on this as well. But that usually debt is, not, it's an immediate concern, but it's also sort of a medium-term issue, right? In significant ways. And it's worth thinking about, how, let's say we have a vaccine, let's say, things are moving forward, sort of in the middle part of 2021 to some degree in terms of the implementation of where the vaccine is really having an impact, right, on the incidence of the virus. That debt issue is going to be really critical, it seems to me. And I don't know if you have any thoughts on that.
Well, for sure, it's a loss that a lot of people have experienced, and nothing can really compensate that. And even if the vaccine comes and things go back to normal, you will always have that loss to bear with. So I agree with you.
Right. Yeah. Okay. So I'll just move on to Leila and sort of a question about maybe what you think perhaps some of the policy responses that have come, maybe economic, but also potentially health-wise or socially and that sort of thing, that you maybe think have been introduced in Latin America, maybe Ecuador more specifically, based on your own experience, but also because I know that your business, you're based in New York. We also have operations in the Netherlands and that sort of thing. So you've been, probably more than most of us, moving around a little bit over the last 6 to 8 months. And I sort of wonder, what you maybe have noticed about, sort of the responses in Latin America or Ecuador specifically relative to maybe some of the other places that you've visited or other things that you've kind of experienced in one place or the other.
Sure, thank you so much for having me. And yes, of course, in Ecuador, we saw probably the first case already end of February. So we were one of the first countries hit with the virus, and it was one of the hardest hit. The immediate response, of course, was different than the ones that saw it already coming from being aware that it was. For example, El Salvador knew about it, didn't have a case, and already did a stay-at-home lockdown.
Yeah.
We did the response, which was basically locking up everything. We had very strict curfews. We had restrictions of mobilization with license plates. It was for 2 months pretty dire. Basically, the industry shut down. Later on, there were added
like April.
Yes, we're talking mid-March to beginning of April, even mid-April. We had, then slowly they started to help the industry that was most relevant, not only essential workers in the sense of health, but also the exports, which is the main income, like besides oil, the main income of the country. So they started to give those passes to that industry to allow them to continue at least to a minimal base or the basics. It was complicated because the mobilization, even especially Guayaquil, which is the main exporting port, was difficult. There were car restrictions by license plate and so on. So the industry had to become very creative in hiring different cars with different license plates to move over. But that was just the response to help the spread of the virus, which was one of the responses of the government. Of course, then there came different type of responses. One of them was just more on a basic level of making sure that utilities were not cut off, or making sure that there was a little stimulus of $60 for families that had under $400 per month. But there were also then some larger implications. One was they did some deferral of taxes. They also used some taxes, increase in taxes. So that was more the political part as an opportunity, I would say, even. But then we also had another part, which was interesting, that they started to focus also on the small business aspect of how important the local businesses were, the smaller ones, not just the export industry, but also the smaller, because e-commerce, which was in Ecuador actually underdeveloped compared to other countries, started to increase. And this brought up, and that's probably the opportunity that I see, is brought up some value of having smaller companies that did deliveries, that did, and they also received some funding from the government too. So generally, the response, I think, in Latin America was very driven also on the popularity of the government, of what they wanted to project. So we have two sides. We have one that were very strict with lockdowns and very, how you say it, protected. And the other ones that were basically ignoring any scientific facts or trying to ignore the problem or trying to just say, well, we have to deal with it. We'll just continue the way it is. It's not as important. We have other things, as Hernando already said, we were already not in a good situation. We can just not make it worse by. So you have really a very diverse response, even though politically some opponents that were one very conservative, one very leftist, they somehow have the same response, which is also very interesting. I think it has more to do with the popularity of the government.
Right.
Compared to what was interesting for me is compared to New York, which had the same timing as Guayaquil, which is my city. Both of them had the virus early on. So both of them came and had probably one of the strongest lockdown reactions based on the fact that they didn't know what they're dealing with.
Right.
Suddenly they had a death rate that was increasing every day. There were no treatments known yet for this virus. There was not even exactly known how it is spread. So I think that that similarity we can see. The difference a little bit on that Ecuador shortly after also decided not to go with the essential workers just as health, but also as the export, which was a revenue stream. New York was more trying to force it into essential workers, and logistics and everything was still open. So anything that's US was still, they were considered part of the essential workers.
Yeah.
But and there was a similarity also on a stimulus, a small stimulus for the population. What I saw interestingly in Europe is that they were trying to protect the labor force by giving even up to, in case of the Netherlands, up to 90% of the salaries of the employers of the employees to the employers for a certain amount of time if they can prove that they have been hit. In the case of Ecuador, the labor law actually, which is normally very strong, was actually loosened up. So they were able to decrease salaries. They were able to shorten hours. They were able to find to have some cuts without all the regular implications of benefits and so on. Mm-hmm. So we see that's also the difference between what one country is trying to achieve with the other one. Mm-hmm. Generally seeing, we're still in the middle of it. So the implication is still long-term. We also talked a lot about the informal workforce, which is very high in Ecuador. Mm-hmm. They, of course, they had to go out. It was not for most of them, even though it was just even making their everyday earning harder because mobility was more expensive or more complicated. So we're still in the middle of trying to find out what really the outcome is going to be. So that's the bad part. And the good part is I do think that some smaller businesses or some local businesses will have found finally the value within their community and society that they can actually bloom or have a push from not only government, but also from the locals that are supporting them.
Right, yeah. Okay, fair enough. Yeah, I mean, I think there's been an education, a big learning curve. I mean, you mentioned it in terms of, just understanding how the virus is transmitted and, like early days, there's very, very little indication of what to do. So it was just locked down, right? And obviously the economic implications of that were massive, right? And very quick. And so it kind of ties into a little bit of what Fernando was talking about. And I think, I don't know, what is your experience for any of the panelists, in terms of this question of, sort of limiting mobility, limiting, sort of certain types of economic activity versus obviously undermining, right, additional economic productivity that could potentially come from any sort of reopening, right? I mean, this is, has there been a learning experience that has caused any significant change in the way that governments are approaching economic policy, during the virus, during the pandemic?
Well, the lesson here in Panama has been that lockdowns alone don't work. You have to couple them with education, with testing, with tracing. Otherwise, just stay at home doesn't work as a measure to control the pandemic.
Right, I see.
That's the difficult questions for governments. I mean, I don't want to put myself in their shoes at this point in time because it's a no-win game at the end of the day.
Right.
And we did see different approaches in different countries. And for example, in Mexico, it was the other way around. Given the enormous amount of informal economy that goes on here, well, shutting down is pretty much not an option.
Right.
So at the beginning, when all this started, and Laila highlighted how Ecuador reacted really fast, some of the countries in Latin America imposed very tough curfews very early on. It was not the case in Mexico. And then, but the problem is that the health situation starts deteriorating at such pace.
Mm-hmm.
And I mean, Mexico City, more than 25 million people live in one place. It's clear that this is going to start spreading out of control. Healthcare system is not built for that, and the government didn't have the response required. Mm-hmm. So you end up having a very critical health situation, mm-hmm. and then the shutdown measures come, and like Fernando just mentioned, it's, well, people cannot just stay at home waiting for things to improve. So it's a very difficult situation. You have people that live on a day-to-day means basis, and they have to go out, they have to find work, because otherwise they're not going to be eating that week. So it's a very difficult situation to control in Latin America for that reason. And this is probably one of the main reasons why this is going to stick with us for quite a while. Mm-hmm. Why this economic situation is going to be tough for the region much longer than for other more developed countries.
Yeah, and I like the point also that Fernando makes about, like it was very similar in Argentina where there was it hit late, and they locked down very early. And so the assumption was that, there was going to be some ability to create a buffer, right? And nevertheless, right, it hit later, and the lockdown was even longer than maybe in other places because they started before it even, right, had significant incidents in the country. And so the economic impacts in Argentina have been absolutely horrendous, as other places. And it does really bring up an interesting kind of question about what does a lockdown, so if the lockdown doesn't work, then what do you do? Because if there is potential for incidents to increase regardless, then the lockdown, then a full-on stay-at-home order, right, may not be the best answer. But then what is, right, in terms of kind of balancing, sort of public health and economics. Right.
At the end of the day, some of the things that they've tried to do is to establish how critical is the business to daily life and to the economy, and to try to impose different sets of rules for different businesses. Right. So if it's not so critical and you can do it at home, then offices are shut, mandatorily shut. Mm-hmm. And if the business has to absolutely get together, then they have special permits. Right. But then again, it's a halfway solution, and still with its challenges.
Right, that's a little bit what Ecuador tried to do with the salvoconductos, with the passes. It was based on industry. It was based on how important it was. It was a learning process. It was not something that they established from the beginning. Mm-hmm. It was after months of lockdown, they realized we need to get exports out. We need to, and it is also, I think Fernando nailed it when he said it is a mix of things that we need to establish. It's not just saying either lockdown or that one. It's testing. It's new treatments that came along, even though they were not really cure itself, but we knew later on a little bit how to treat this virus, how it's, and that also helped. As at the beginning, it was just the main panic. We have this virus. It was already in Ecuador. We had dead people on the street. We were really like in the news of that, and what to do with it. Mm-hmm. And I think there's really not a right answer. I agree with Fernando, the balance between the public health and the economy, and both of them affect each other. So we don't have a safety net like Europe that's, first of all, hospitals were well more prepared, and generally there is even a health insurance and so on, which we lack for. So definitely some difficult questions and not really one answer.
Yeah. Yeah, I want to jump off that point about adaptation and change and think a little bit about, and even the balancing act, right? And ask a question to Carlos about, maybe how not just governments, but how maybe businesses or communities have kind of tried to adapt, right? So it's not just policy that has to kind of strike this balance. It's also individual businesses. It's also particular communities, right? And that sort of thing. So, in Paraguay or in the region more broadly, based on your experience, how have you noticed that, working habits have changed? I mean, Leila's mentioning like people getting multiple license plates, but, sort of other maybe adaptations that may have occurred, within particular businesses to try and sort of manage this crisis, right, in a domestic sense, and even maybe, sort of if it is an international business in an international sense.
Well, Paraguay is mainly off the radar of many people. We're not one of those. We're not New York City or Rome where everyone flies into. So we didn't get that many foreigners coming in and out of the country. That helped us at the beginning. And since Paraguay was maybe the first country or just about in Latin America to close down, then we were able to get to stay for several months on the safe side. Up till the end of July, we had less than 20 deaths altogether in the country. So people, when the government started demanding people to stay home, closing offices, installing a curfew, which was on for more than 2 months from 8 p.m. till 5 in the morning, people stayed home, watched TV, and they actually saw what was going on throughout the world. That helped them a lot to just, calm down and stay home to see what happens. We were fortunate enough to not need as much medical supplies as other countries. So when everyone in the world was fighting over the shortage of medical supplies, we still didn't need them. So that helped us a lot also.
Right.
On the other side, when Paraguay closed down, that meant that all non-essential businesses had to close down. Schools, everything were closed. But they opened a small door, which was supposed to be for essential businesses, including all kinds of foods distributing. They left construction open, so that left lots of businesses working. They did install mandatory hand washing kits outside of every single public space, which is still on today. You cannot walk into a pharmacy or you cannot walk into a supermarket without washing your hands, getting alcohol put on your hands, and then someone taking your temperature. Shopping malls were closed for 3 full months. So that really made it complicated. But people were so worried about what was going on in other places that they held on. Now the government started giving out aid right at the beginning. 2 weeks into the closing, the government was already announcing salaries distributed to all people whose businesses were closed. All workers and workers who had what we call here informal jobs, who are not registered, they just got a plain aid. I mean, they went to the police station, they got a certificate that said that they worked as a plumber, carpenter, whatever, and they actually got half a salary from the government that month, and every month from there on. So that helped the economy to withstand. Now, Paraguay had a very, very low foreign debt. So it's very easy for Paraguay to contract more debt. That helped a lot.
Right.
Now, businesses they've had to completely change, to readapt. Restaurants are still maybe at the most 40% open, but most restaurants within a month were already working on sending delivery of even good international platers to homes. So waiters became taxi drivers or motorcycle drivers taking food to homes. Teleworking grew a lot. Fortunately, what happened, this pandemic started when internet was working pretty well. Imagine what would have happened 40 years before, when actually there was no ways to communicate with each other. Everyone today, many banks or many public offices, people are still taking turns working. So only have like 70% of the people at the office in shifts, just in case someone has a problem, that whole shift stays at home. They ran a survey a month ago, and it turned out that 85% of the surveyed population switched from buying whatever they used to buy before, foreign, to buying local options if they were available. So that really helped the local industry a lot in local production. People were buying in the streets fruit from local street vendors. Whenever you had two choices of whatever, people chose locally. They said, I gotta help my fellow countrymen, or not citizen, people live in the country. And that really helped a lot. The country was able to, pull itself together and keep on going. Now, our problem is that we're landlocked. Our neighbors are amongst the countries with the largest problems. And our borders are very, very unprotected. I mean, anyone can cross our borders by either water, forest, or a regular pasture and come to Paraguay or leave Paraguay. So by the end of July, when the government started to open up and allow more social gatherings and things like that, then the rate of infections grew sharply.
Right.
So only within the first 2 weeks of the month of August, we had more cases of infected people than since the beginning of the pandemic. Right now, we're up to about 80,000, which is close to 1% of the population who've been infected. 3/4 of them are cured by now. We're up to about 1,800 who passed away. That's about 240 in every 100,000. But the people have really gone what I call back to basics. I mean, they do a lot less traveling far away. At the beginning, you couldn't even travel outside of the city. Now you can travel anywhere you want in the country. There are no more restrictions, but people choose not to go too far away. People spend a lot more time in the family with a very small group of close friends. And, they're just concentrating on their closer net. Family, close friends, and work. That's it.
Yeah, I like this notion of learning processes that you mentioned. So it's not just that, health professionals are learning from other places, or, governments are learning from, looking at what, other hard-hit countries have done, but also individuals, right? They see the news, they see how human behavior, group behavior, those sorts of things have, impacted one thing or the other. And so there's kind of this transfer of knowledge, in Paraguay's case, because it hit later, then there is a transfer of knowledge and some experience, right? Maybe drawn from other countries that were hit previously in sort of from a social perspective and from a business perspective, right, as well.
There are a couple of unique things that happened here. We had hospitals closing down due to the lack of patients. Because with people staying home, kids not going to school anymore, everyone eating at home as compared to eating out in the streets. Kids were not getting sick. I have friends who are pediatricians who are just about out of work. Right. They haven't had any patients to try because kids don't get sick anymore. And if they do get sick, parents do their best not to take them to the pediatrician or the hospital.
Right. Yeah. I mean, I know that's been the case in the U.S. in some places. Primary care facilities have actually suffered a little bit, in terms of their businesses, over the last, since the beginning of the crisis. We don't have a ton more time, but I did want to sort of, think about, sort of forward-looking things and implications and that sort of thing. So, Hernando, I wanted to sort of see if maybe you could provide some thoughts on, I think, we've been talking a lot about kind of social behavior, social implications and those kinds of things, as a result of the health and economic crisis. But I'm also sort of wondering, how can we think about this as, potentially an opportunity to, in a forward-looking way, in the near to even medium term, right, learn from this crisis, right, and maybe continue in a new normal, right, and not back to the old. Like
when the new normal comes,
right? Like
when that is
5 years or whatever it is, right? Whenever we declare that there's a new normal, what will be new about the normal? I guess potentially, or what's valuable about a new normal.
I think this situation has forced everyone to change one way or another. So we had to adapt. We had to learn how to work remotely for the most part. So the people that could do it are working remotely, and it has definitely opened up new opportunities. And it has definitely opened up new ways of working. So that, I believe, will continue, and it will drive us forward. The other part, and Carlos mentioned this, we did see a lot of support within the community for each other. And I think this was pretty much across the board. It manifested itself in different ways, but I think that also will help in the future to continue with this sort of social behavior, that it's not so selfish anymore, but it's going to be a little bit more towards the community. Those are the positive things that I can see coming out of this that will endure, hopefully. For sure, the way we interact, the way we work will change. I used to, and we've discussed this before, but I used to travel massively, and that will definitely change. People will no longer be traveling so much for business. All these virtual environments have definitely blossomed and are here to stay. Whether the office environments and gathering environments will be the same, it's also up for grabs. I think that will be a permanent change into the future, because suddenly businesses figured out that we can keep on working from home. Maybe that's not ideal, but a hybrid of how we work today or nowadays and how we used to work is going to stay with us. So it will change the way we interact. It will change the way we deal with the day-to-day business. But I do see a lot of positives that will come out of this, and we will for sure have some negative consequences, but we need to start. I mean, we've had a tough year behind us, almost a year now. It will be tough for a while, so we better start thinking positive and thinking how we can take advantage of the positive things that this situation has left us. But I do believe that there are some very positive things.
Yeah, it's interesting to think that, like, we're socially distanced, right? But like you're suggesting that it's actually brought certain communities closer. Which is quite interesting to sort of think about. So closer,
it reconnected a lot of people.
Yeah, fair enough. And I think BMW is a good example where you have you have the executives, but then you have maybe sales, which could transition to some degree, but obviously you have manufacturing, which it's hard to see that changing, right? In terms of sort of people needing to be right at the manufacturing center and that sort of thing, right?
From that perspective, the manufacturing will have to continue.
Yeah.
But on the other side, I mean, we used to have very large workshops, worldwide workshops, so get together in Germany, and it was all the markets in the world are there. Needless to say, this year it hasn't happened. And we have done them all virtually. Now it's very difficult to do this virtually with the Asian time zones and the American time zones converging at the same time. So that is difficult to happen, but it has worked. And we have had workshops with more than 300 people at the same time with interaction. The technology is there. And like I said, it has taught us that we can do it. And you mentioned sales. On the sales, you also have a lot of this personal relationship basis that I do believe you need to continue to have. It's important to have. And it's important that we don't lose all physical connection. I think the social physical connection is important to have as well. But it will definitely change. It will definitely have a different connotation in the future.
Right. And it is nice that we can get somebody from Panama, from New York/Ecuador, from Asunción, and from Mexico City, and Worcester, right? In one phone call, not to mention, all the other participants today. I'm going to leave it there. I think we've done a really good job, I think, of addressing a number of these issues, not just from an economic perspective, which is obviously important, but how economics is a social science, right? It's about people and communities and societies and that sort of thing. So it's about social welfare as well. So thank you very much for your participation today. It's really been a fantastic afternoon overall, showcasing, I think, the global school to some degree, but also Latin American and Caribbean studies at WPI in really important ways. and I thank you for contributing to that. I think we've been able to see how, sort of research and discovery and technological development can be a part of what WPI is doing in terms of the Global School in Latin American and Caribbean Studies. We've seen student project work, we've seen faculty and institutional engagement, research, the ability to connect these different pieces of WPI's engagement with Latin American and Caribbean studies in really, really important ways. So I just want to say thank you to everybody that participated. I want to say thank you to Rachel, Roy, and others for helping us to organize this event. I want to say thank you to our alumni panelists again for their excellent participation. It's been a really great experience interacting with you all over the last month or two as we've been planning this. I want to thank our faculty project center directors for a really interesting panel demonstrating how WPI misses to some degree, but will soon have sort of student boots on the ground, as it were, making some of those bottom-up connections and building from those institutional connections from the bottom up. I want to thank Paul Matheson and Wole for their discussions of sustainability plan, and to Wole for introducing this afternoon in such an eloquent way. And finally, to Carlos Nobri, especially for his thoughts on the risks and opportunities of development in the Amazon. So all that in a matter of a few hours was really, really, I think, an exceptional demonstration of what WPI can do and how it can interact with Latin America and the Caribbean in really interesting ways. So just finishing up, a quick reminder that we have our Global School virtual event series continues after the new year. In January, there's going to be an event similar to this on the Middle East, and the Oceania group will be up on February 9th as well. So thanks everyone, and we'll see you in January. Take care.